Hi, my name is Dr. Lance Loomis, coming to you from Carney Chiropractic Center in Parkville, Maryland. What we're going to do today is demonstrate some exercises that we teach patients to do at home. We find that it's a really important part of their care and the healing process. So let's get started. Okay, so now what we're going to look at is another variation yet on the plank, this time with the elbows on the ball instead of the legs on the ball. So you can start in this kneeling position and just roll out like so. I can keep my elbows underneath my shoulder, just stay on my knees. This is pretty simple from here, but it's a little more rocky and unstable. And then I can come up to my toes here and then hold this position. Okay, use that as a rest. Then you can also do this from a standing position like this, where you slowly roll yourself out over the ball into this plank position. And then hold it, and then you can roll back up like that. Okay, so those are two variations on the plank using the ball under the elbows. Okay, so go ahead and roll forward here. Good. Again, we assume that same plank position, knee, hip, shoulder, all in a straight line there. Elbows underneath the shoulders. You'll find that if you start straightening the arms, it gets a lot more challenging, a little more strenuous for the abdominals, but another variation that you can do. Bring that back in, and then back to neutral. Good, so then she can go out and then lift the knees off the floor. Again, everything's in a nice straight line. It's good to have somebody else to look from the side to make sure that your rear end isn't sagging towards the ground or piked up into the air. So I'll keep everything straight, and then she comes back to the knees. Good. Good. And then if you want to try the standing variation, you want to bend at the hips and then slowly roll forward with control. Good. Roll back up. Good. You want to be careful with this and that to round your lower back when you do this, because that's going to put a bad stress on your lower back. Instead, keep that little arch. Kind of stick the rear end out like a duck butt, and then